we could probably get started. Thank you, everybody who is joining us today. If you'd be kind enough just to put your name in the chat box, the organization and county and state that you represent, because I don't know everyone. Most everybody I do, but sometimes I miss a name or two, and that way I can just grab it and keep a log, and that way you guys will be sure to get the recording of this as well. And if you'd be kind enough to just put your phone on mute, camera on mute, that'd be great. You guys can, we can watch your faces if you want, but just turn the mute off unless you're asking a question. So welcome to Office Hours. We have with us today as guest speakers, Donald Reed. He's the Executive Director of the McDowell County on Aging. And if you guys, some of you guys may remember Donald from last month. That was so kind to join us. And we also have Commissioner Robert Roswall with the West Virginia Bureau for Senior Services, and they'll be talking about aging well in West Virginia. But even though they're saying West Virginia, they've also got a discussion planned for all of you all that are from out of state. And Mr. Roswall, just so you know, we've got people on here from Mississippi and Alabama, as well as West Virginia right now, anyway. So our project kind of covers 8 of the Appalachian states. So I know you guys will be sharing some information about your senior centers and nutrition and all of that as well. That's happening outside of West Virginia. So I'll turn it over to you guys.
Commissioner, you can start.
Okay. Well, my background has been in aging and nonprofit organizations from Worcester, Ohio, to Huntington, West Virginia, and now in Charleston. Been in the aging programs for over 30 years, appointed by Governor Tomlin, and I am currently serving under Governor Jim Justice. So I want to tell you a little bit about West Virginia and how we're structured in our aging programs. But the Older Americans Act was passed in 1965 by President Lyndon Johnson, and upon that basis of the Older Americans Act, there were other programs added as we went along throughout different years. This was the first actual legislation that addressed aging throughout the United States and in the states. You'll see there that in '69, they gradually added different pieces. They added demonstration projects that started senior services in Southeastern Virginia. Congregate meals was the very first one in 1972. It was just celebrated its 50-year anniversary. Transportation was later added in 1974. In West Virginia, transportation, our aging providers throughout the state, and there's one in every county, they're often the primary transportation source in this state as it relates to getting to medical appointments or hospitals, and often to and from a grocery store. There's lots of counties that do not have transit systems. Home delivered meals shortly followed in 1978. Then after that, we got more involved into in-home services and independence within your home, of getting services to individuals so they could remain in their home. Then rights to individual elder abuse and elder rights. With that, we have a West Virginia senior legal aid, an attorney that can answer questions on behalf of seniors and direct them in the right directions on how they get a few things settled for them. That's a very active one. And then the last thing added to us was the Family Caregiver Act. Now, West Virginia, prior to that, already had a family caregiver program that once we got the federal, it was all rolled together into a caregiver. And this is basically dementia and Alzheimer's services. It includes both in the individual's home and in congregate settings. Structurally, the Bureau of Senior Services is attached to the Administration on Community Living, which is part of the U.S. Department of Health and Human Services. Within that, nationally, there's 56 area agencies on aging, 56 units on aging, and 624 area agencies on aging, and over 29,000 provider agencies throughout the country. The Part 8 of the Older Americans Act, which most of us would call the administrative part, it kind of explains the responsibilities of the state units on aging, like the Bureau of Senior Services. It talks about the independence, social barriers for individuals, the continuum of care of the services, how it flows through the lifespan of an individual as they turn 60 and beyond. The state unit, our primary focus is writing policies for the state, the funding formula on how we distribute the funds throughout West Virginia. And West Virginia is organized, and you'll see it a little bit later, into every county has a county aging program that we fund. So there's 55, but we have a few extra where programs are split. And so we'll end up with 58 provider agencies throughout the state. But we advocate to the legislature on programs and new programs, provide them information that allows them to get a better idea of what we do, how we operate. We also set the standards. We designate who are the area agencies on aging. The area agency on aging, now there's 4 of them. They can be de-designated. It's a very complicated process, but West Virginia has gone from as many as 12 area agencies on aging down to 4. Most of the time that took place, it was a legislative act, which allowed us to do it pretty much outside what the Older Americans Act would have mandated us to do, which is a much more complicated process. The area agency on aging, we fund them. They decide how the money is distributed throughout their regional area. They can use the funding formula that we gave them to process the money to them, or they can use their own funding formula, or they can use ours and add a base to it. They have that authority within the funding process. They have the direct relationship with the county provider agencies. They monitor those agencies to make sure. They help designate the focal points. In West Virginia, the focal points are at least one any fully functioning senior center, not just a nutrition site. It has to be a fully functioning senior center. And then they help coordinate the community long-term care services. Part B of the Older Americans Act is what we would call pretty much the senior center operations and some of the in-home care. So this is primarily where most people would fund the operations of the senior center outside the nutrition services. The services that would be in this would be personal care. There would be adult daycare services in there, homemaker services, but under the Older Americans Act, homemaker services is housekeeping services, not homemaker as you relate it to medical care. Personal care is the medical part of the Older Americans Act. West Virginia does not have residential repair or renovations. It will be starting October 1st as a model project through the area agency and the Aging and Disability Resource Center. Part C of the Older Americans Act is our nutrition programs. Part 1 is congregate meals served in a congregate setting. Part 2 are home delivered meals. Our meal services are normally about 2 million meals. Since COVID, we're serving over 3 million meals. It was a 60-40 split, 60% congregate and 40% home delivered. It has completely flipped to 60% home delivered or grab and go during the pandemic to 40% congregate. We're still having some difficulty getting seniors back into the senior centers. Part D of the Older Americans Act is the family caregiver part. That's the respite programs and the Alzheimer's and dementia programs. The Bureau of Senior Services also gets funds from the West Virginia Lottery. West Virginia State, through the lottery, provides, we get more money from lottery in the state of West Virginia than we do from the federal government. That comes to us on a national funding formula. Within that federal money is match money for all of our federal programs. We're overmatched, which means we have excess, which assures us that anytime they give us additional funds and we have to match it, that match is already in play. But the lottery dollars are in the nutrition program, and it's also in two programs that are newer for us, which is called Lighthouse and FAIR. FAIR is a state version of the Title III-E Alzheimer's care programs. The difference for this is on a federal program, you can suggest a donation, but it has to be confidential. On both of our state programs, those have a sliding fee service to them. So, and there's a minimum that is requested. So with those programs, so there's Lighthouse, which is a personal care program, and FAIR, which is the Alzheimer's and dementia type programs. With those, prior to COVID, we were doing 800,000 hours of services, and we were receiving over $1.3 million in contributions on that program, which go back to do additional services in the next fiscal year. Part of senior legal aid is state funded. That's senior legal aid with any topic. We have one attorney statewide that does that and takes those calls. Long-term care ombuds is the advocate for nursing home residents. They deal with the resident unless the family has power of attorney. They take care of issues within the nursing home, which may be any complaints they may have about the operations or how they're treated in a nursing home. One of the ones that we had a very successful activity with was the nursing home. All the mail to the individual that was there was being addressed to the nursing home with the name of the individual attached. The nursing home was opening all that mail, which also include private information. They complained about that. The long-term care ombuds did file a suit against that. They won that suit, and the nursing home was financially penalized for those actions. The next item you see there is silver-haired legislature. This is a mock legislation that does similar things as a legislature would do. They will draft bills. They will go from House to the Senate side of the silver-haired. If they're passed, they are then packaged and taken to the West Virginia legislature as recommendations of what the seniors would be interested in having the legislature do. It varies a great deal. Couple of the biggest ones that keep popping up, they did get a thing about four-wheelers. Being a very rural state, there was an issue of four-wheelers not having licenses on them, but also getting into people's farms or wooded areas and that type of thing. They did get past licensings for four-wheelers. So they do have a license on them or identifying on a four-wheeler now. The other one that they always have one on homestead exemption. There is a homestead exemption, a minimum of $10,000 off the tax assessment of a senior's home. And those were two. One that they continuously push but never gets anywhere. The House passes it, the Senate always defeats it, is drug testing people who are on public assistance. It's been successful, but not completely, and the legislature really doesn't want anything to do with that one. So those are the main things that come from those two programs. And I've mentioned to you the nutrition and transportation. The resource network, this is a version of what will be No Wrong Door. It is run by one of our area agencies on aging. There are 4 of those. Each of them have a piece of this No Wrong Door part. We have signed a contract with a firm out of Massachusetts to develop our data system. this system, the key partners in this at this time is our behavioral health, DHHR, Veterans Affairs, Bureau of Medical Services, the Bureau of Senior Services, and then the area agencies on aging are the kind of the operator. An individual calls in, they deal with a trained social worker who will take their information, ask them what they need to put all of this into a data system. They will then tell them what's available to them. They can actually process some of their applications through the Department of Health and Human Services. They can track it in a sense of follow it where it is. They don't make determinations, but they also can at that point refer them to any of our partners. And with them goes the file with them so that the next agency that may handle them only adds information that may be necessary for them to make them eligible for their program. The senior never has to call the ADRC back. The ADRC will call them back with additional information or to request information. With that, we have funds for marketing and for to target the services. Part of that issue is we noticed when we were in COVID that people would sign up to get their appointment for the vaccinations. The issue we had with seniors don't seem to answer the phone if they don't know who's calling them. So if you don't leave the message or they can't identify that number. So we're looking at getting a phone number that identifies that it's the ADRC when that call comes so that they can be notified, look for this call to come back to you. So it makes it a no wrong door. And then those partners, then our aging county-based people would be partners in that if we send a referral to them, they have the ability to go in the system, pick up that referral, respond to it, and put the answer back into the system. Now, the ADRC, if they send a referral to behavioral health and they didn't respond, they have the ability to send them a little note that this has been laying for 5 days or however many days to trigger information to make sure that the senior's getting served. On the next slide, Donald, I had talked about the area agencies. This is where you see how they are. There's 4 of them, and they're basically pretty much evenly population divided. But when you see this map, we have not reconfigured them. So within them, the red one is what we would call the metropolitan area. That is where the capital county is, and then one of the next largest. So it's a populated area primarily on the Ohio River and into southern West Virginia. The very bottom right of that red, and then going into the bottoms of the greens, that's basically the coal fields. That's also where Donald's going to be from over in the green area, the coal fields, and that is Appalachian area agency on it. The blue is the other fastest growing area of West Virginia. It is both the most urban area and the most rural area. That's the panhandle that attracts the people out of Baltimore and Washington, D.C. upon retirement. Lots of good property, lots of farmland still undeveloped there, as there is in the green area all the way down the Greenbrier Valley area. So it's our fastest growing area. And then the yellow is the northern panhandle area and down. Most of the yellow area are very small counties and areas. A lot of people in that area, but it's also that northern panhandle. Don't know the research to it, but that is normally our oldest population area in the state. We'll have more older elderly in that area than any other area in the state. This shows our county providers and that it shows them also as those area agencies. There's still area agencies and what counties are in them. The yellow one is by far the largest. It has 16 counties, but they're very small counties. One of them will only have 1,100 seniors in the whole county. And then you'll go to the big green one, to the middle right of the green one, and it's going to have 50,000 seniors. So, and again, as I said, it's very rural. And when I took the issue there, that our largest city is just over 50,000 in the state, and that is the capital city. So you'll have several that hit the 40s, and that northern panhandle growing over towards in Jefferson County is headed towards the 40,000. So it's very, very rural, very isolated in many areas. The blue area is primarily the mountain area, and that's the area where it's hardest to reach people. And we're talking very isolated, mountain isolated, and rural, but entirely different thing from the rural you'll see in the southern part of the state. And I'll answer any questions for you if you have any before I turn it over to Donald. But we're very proud of what the Bureau just did with our state plan on aging. Some major transitioning, some major targeting to groups. We have targeted, and we have the data that we're preparing to share next month out to our provider agencies on where they will find our target groups that we put in our older state plan, which is the oldest of the oldest, the minority populations, and the low income senior populations. We have done those all by rural and by zip codes to get us that information. Now, when I say targeting minority populations in West Virginia, there's only a 3% minority population. Our other fastest growing areas, again, is going to be Latino, and that's going to fall primarily in the northern panhandle part of the state. So we want to target those things, as we also are a big push in our state plan on self-directing, that the individual that are receiving the services have input in those services, how, where, and when they get those services. So any questions you may have, I'd be glad to answer those before Donald gives you more information on how the local area and the senior centers operate.
We'll open it up. I'm sorry. Was someone trying to say something? Or was it just me? Okay. All right. If anybody has any questions for Mr. Roswall, you can put those in the chat box, or you can go ahead and ask your questions now. I do have a question, or at least a comment or two. I heard you mention home repair services.
Home repairs and modifications. It's a focus on modifying the home to allow the senior to stay in it longer. It's
okay.
Early stages, so it's the grab bars, the ramps, but we do have some funds that allow us to work on some roof repairs, some other repairs that will in the bathrooms that will allow them to stay in their home. Plumbing issues and things like that, but no major things go through our ADRC, who has connections with other nonprofits or charitable groups that help them get those taken care of.
And how would someone qualify for that?
Well, those are all qualified just on the need. There's no financial anything related to that. And it would go through the Aging and Disability Resource Centers.
Okay. And they would need to probably just contact their local area
Agency on Aging, yes.
Agency on Aging. Okay. And do you know, because we have several folks on the line that are out of state. We've got some folks from Kentucky and Mississippi and Alabama represented here. And I'm wondering, for the ones of you that are out of state, if you guys are in touch with your local area agency on aging.
This is Shirley in Alabama. And yes, we are very, very in touch. I'm on her email list for new information and events that are going on, and we can call her for anything. So we're definitely in touch. And at many of our health fairs and events, they have a table that are passing out information, answering questions. So they are very involved.
Okay, and I see Catherine is too, and Catherine's from Mississippi, so that's great. Just wanted to make sure.
Let me add one thing about when I told you the structure. West Virginia is in region 2 of administration on community living. That contains New Jersey, Pennsylvania, Delaware, Virginia, Maryland, and West Virginia. And when we meet, and we meet a couple of times a year as a group and then virtually, the one that surprised me when I look at that group, the agency that operates the most like West Virginia is Washington, D.C., which really shocks me in the size of it and their populations and stuff. But they're the most like us in operations of these programs.
Interesting. Very interesting. And then I did not know until I saw just the other day one of the food trucks, one of your meal trucks.
Yes.
It had the lottery logo on there, and I thought, I bet they're receiving funds from the West Virginia Lottery, and I was unaware of that. So that has to be a good chunk of money.
It is, and we receive more lottery dollars than federal dollars.
Yeah.
And if you saw the truck with the lottery on it, the legislature gave us $1 million to buy those vehicles, the hot cold trucks.
Okay.
We took those based upon size, and the smaller counties pretty much got them for free. Counties that have the ability, and most of our providers are in Medicaid, doing Medicaid in home, where they can generate fee for service. If they had money, they shared in the cost. So some of them may have been like the capital city county. They would have had funds and they probably paid full price, but we bought them on state contract. So we bought like Ford Explorers and we got them for $30,000 and they're loaded. So you can't go on the market and buy a Ford Explorer for 30. And the trucks came in a little bit more than that, probably closer to 40 to 50,000. But we ended up spending more like almost $2.5 million, and we bought 40 some vehicles for the counties. And we're anticipating doing that again before too long. It's not in our next budget. But
Yeah.
we did redo that.
Thank you. Thank you. Any other questions? If not, we'll turn it over to Donald.
Okay, I'm Donald Reed, and I have been the executive director of the McDowell County Commission on Aging for just over 4 years. So you have Commissioner Roswall, who's at the West Virginia Bureau for Senior Services. And then if you're going down the chain, you have Dr. Rebecca Bivens, who's at the Appalachian Area on Aging. She is my area on aging that we are under. And then we are a county provider, which is a much different perspective. West Virginia's aging programs, I always say when I work in tobacco control that local people listen to local people best.
Right.
The same thing is true in the aging network. When you look at other states and other models, and then you look at West Virginia is very grassroots. You know, these are your neighbors helping your neighbors. Senior centers are very much neighborhood, community-based, and they're all community-based services. You can see our logo here, and if you've ever been to McDowell County, we are in the mountains, the coal fields of southern West Virginia, and you don't just end up here. If you come to see us, you meant to visit. And because we are a very rural community, and because, you know, when I was a child, the school system was kind of like the community hub. And as as schools have consolidated, as the public's access is limited to school systems, I kind of take the approach and the viewpoint that the senior center is almost the community center for that community. And that's how I run the Commission on Aging in McDowell County. A little bit about me. Well, let's go to the bottom right, or excuse me, the bottom left. That's actually our board of directors. There are 12 members. To the right of that is my youngest son, Keaton. At the top, no disrespect to Marshall, but I have great loyalties at WVU with President Gee, and you. Those of you who know me personally, my wife is in the middle photo, and the last photo is at our senior picnic. I also am a full-time faculty member at Liberty University. That's really important for the Senior Center because I teach in their Masters in Public Health program. So their MPH students work on very specialized health topics with our seniors from a distance. So that's kind of taking the different hats that I wear and helping it to benefit the Senior Center. We are almost 50 years old, and if you remember the commissioner's timeline of the Older Americans Act, the agency itself will turn 50 years old next year. Sometimes you will hear Senior Center directors say, well, we're all different. Well, that's true because every community is different, but then it's not true because there are some foundation services that are in every senior center in West Virginia. First is senior nutrition. As the commissioner said, we call that C1, C2 if you want to get into the codes. That's the Meals on Wheels trucks that you often see in your community. Senior in-home care. And I kind of it's almost like a continuum of care. As you age, your needs become greater. You may start out just needing help with housekeeping. And that's our homemaker services. Then as you age, you may need help with your activities of daily living, and you may qualify for our lighthouse services or our personal care services through Medicaid. As you age, if you would get dementia or Alzheimer's, you may be part of our FAIR program. And kind of like we do all that we can to keep you in your home, very much hands-on senior care. Senior transportation, especially really important in rural communities. Transportation for essential items, medical appointments. We have our evidence-based health programming. You may recognize that in your local community as Tai Chi's pretty popular. Bingo size is, I know a lot of senior centers do that currently. And then kind of the hub of senior activities. And in McDowell, most of our population, we have a very, I used to think we had the oldest population in West Virginia. I'm not sure that that's true. I don't know. It's true in my mind. I don't know if it's true statistically. We do some new programs. We've worked with Clemson University on a blood pressure control program. I have a personal interest in that due to some kidney issues in my family where people's kidneys were shut down because of uncontrolled blood pressure. What you may not realize is that your senior center may be one of the top 10 employers in your county, especially if your county is very rural. We have about 80 employees at the McDowell County Senior Center, and we do employee wellness actually through the Department of Health and Human Resources, their worksite wellness program. We partner with WVU on our senior produce bag program, which is really helping seniors who can no longer garden to provide that fresh produce to help their diets be healthier. We partner with West Virginia State University on their Grand Families programming. Senior tours, the senior trips is also, sometimes I think the senior trips are as visible as the Meals on Wheels. Tai Chi, which we talked about, and we try to do a lot of cultural programming to bring things, especially to our community, that our seniors would not be exposed to without the work of the senior centers. These are just some ads. discussing our personal care, our in-home care programs. If you need a ride, just adds to catch people's attention. I wanted to just show you some photos of real activities. The top right, every summer, we have AmeriCorps members, Bonner Scholars. We try to really work on that intergenerational programming where our seniors are working with college students and they can learn from each other. They have very different but unique skill sets, and putting them together, we have found to be really a win. This is one of our community gardens. I don't know what happened. If you're not muted, if you're not muted, please mute your line. Okay, there we go. So that's our seniors with our college students. Our college students are at the bottom. We just had, sometimes we do like a jazz and lunch. We partnered with community college actually across in Southwest Virginia to bring some of their jazz students to come play at the senior center. That's a celloist that was from Bluefield University. And then, you know, a lot of seniors do your flower making. We also have the advantage in McDowell County that we have a partnership with the Jack Caffrey Community Arts Center, so that when our activities get beyond what our building can contain, we move to that center. And this, you know, the top photo is, I think that's the celloist, the photos there. You can see our garden in the next phase. That's kind of when the garden was first started. Container gardening, kind of on a tier basis because of seniors' limited mobility. The bottom photo is actually at the Bradshaw Center. Looks like that's some food tasting or nutrition education. The big group photo was just our trip in May. We took a group of seniors to New Orleans. And just for full disclosure, those trips are completely paid for privately by the seniors, but serve as a fundraiser for the senior centers. My favorite activity is the senior prom. If you didn't get to go to your prom in high school, or if you weren't king and queen, we give you another chance, and always have a good time. There's some more flower arrangements. We try to again bring in different vocalists or instrumentals to the senior center. This is a community dinner, trying to get, you know, especially as we transition, hopefully post-pandemic, trying to get more seniors. Before the pandemic, there was not a seat left at lunchtime in this building. Currently, we're probably less than a half full. So doing all that we can to really try to encourage people to come back out. There's some more examples there. Partnering with the breast and cervical cancer screening programs. Kind of again viewing that senior center as that hub to bring these community resources to our seniors. And for those who are not comfortable coming back out to the senior center, this is some online cooking classes that we actually did in partnership with Marshall. That's WVU's extension agent, Stephanie Lusk. And you can see our seniors as they're participating in this, which is a real accomplishment in this Zoom class for several weeks. Again, here's an event we had at the Caffrey Center. The top photo there is kind of actually like a career day at our elementary school. So again, helping our seniors educate our children about the careers that they had. There's more crafts there. You can see more, it looks like a cooking class there. That middle photo in the middle section, actually is the Lewisburg Chocolate Festival, which is always lots of fun. We've done a lot of work in McDowell County. This is what the Bradshaw Senior Center looked like 4 years ago, and that's what it looks like today. The Welch Center have the same thing. I wanted them to look similar, so they have very much kind of the same color scheme. And I love our flowers that are taken care of by our seniors. And now we're in the middle of a building addition. And going back to, really that senior center working within a community, you have to reach out to the partners around you. I often tell my staff, and I have told our board of directors, if you think that we can sit here just as a senior center and survive, those days are over. We have to be good community partners at the local, regional, and state levels. And I've given you just a list of the partners that we have that are really frequent to the senior center here. And that's our version of aging well in the mountains.
Thank you, Donald, and thank you, Mr. Roswall. I want to open the floor up to anyone who has any questions. I do want to encourage our coalitions that are online, our partnering organization. If you haven't already, to partner with these folks in your local areas. We all of the coalitions that we serve are very rural and poor communities. And the senior centers have a captured audience already. And that's an example, as Donald presented to you of the services that just what, he's done in his community. And I know, Shirley, you mentioned that you guys do partner with your senior centers and things, and so that's great. And and we have other people on here that made a couple comments and said, "Sounds like a good resource," and because there is a captured audience already there. None of us are getting any younger. So I encourage you on my end to, if you haven't already, to partner with your local senior centers and get involved there. So I'll leave this open to anyone who wants to ask questions. No questions today. Any comments? You guys are quite crude.
This is Janet from Kentucky. I have done things that are senior citizen here, but we have run into an issue. We've got some community health workers running into issues of getting affordable medical care. How do y'all address that there?
Well, maybe I'm in a unique situation. We have a state-run hospital that's a mile from the senior center, and we have 3 federally qualified health centers.
How about with like dental and vision? What resources do you have for that?
Well, in West Virginia, if the seniors, if they would be dual eligible for Medicare and Medicaid, Medicaid has $1,000 dental expense that's allowed. Plus, HealthRight has a mobile dental clinic that comes to McDowell County once or twice a month. And our seniors use the mobile dental clinic from HealthRight.
Robert, do you have any resources that you could share with our Kentucky folks at all in regards to, healthcare and dental services, vision services? Um,
Yeah, let me unmute myself. Yeah, we have, like Donald was saying, we have a relationship with those same groups, the mobile dentist groups, but then a lot of that is within our ADRCs, do those referrals and keep those lists. We currently, many of those are funded from foundations and also United Way. We're working right now with United Way on another dental grant, but ours is related to our Title V senior employment program, getting people back into the workforce. And part of that is that we're looking to use that dental benefit to those individuals to make them feel more comfortable and put them back into the workforce market. And we're working with another group similar to Health Right, that's just down from us in Charleston here, that also has the mobile vehicle that goes around. There's many of those around, as there is the one, I guess, Donald, from WVU, the breast exam bus, the cancer bus.
Bonnie's bus. Yeah.
Yes, Bonnie's bus. And we're also working with the Cancer Society here in Charleston in specific areas in southern West Virginia on prostate cancer and other cancer and breast cancers in that area, because there's high populations of that in those areas. We have a lot of those. I can get that information out of our resource, but that resource is online also, self-researchable under West Virginia Navigate is the title of it, is where you'll find our resource center. Is under West Virginia Navigate.
What about those counties? Well, there's some states on here, like from Kentucky. Who would they need to contact to find out about those dental services? Do you have is there a resource that you could share with us either through the chat there, or if you can send it on to Donald or
Okay.
myself, I could certainly send it out to our other states.
I'll send that on to Donald. I'm thinking,
Okay.
I remember that Kentucky may have a dental program because it's the only, well, the region was bigger then, it may not have been Kentucky. One of them settled a lawsuit and all the money went to a dental program at one point. But again, they're all going to have the Aging Disability Resource Centers because it's financially productive for an agency or a state to have an ADRC because it funnels more Medicaid dollars to you for other programs if you have that. Like the transition from a nursing home back to home in West Virginia, it's Take Me Home West Virginia. And that is a fund that you had to have an ADRC in order to be eligible for that. So checking with the ADRC, but I'll send those on to Donald.
Okay, that would be great. And Donald, if you'll just send that to me, then I can forward it out to everyone with those resources. And then that way they can just, I know Shirley sent in the chat here. She's from Alabama and they work with the Lions Club too. So we will definitely get these resources sent out to you guys. And that way you guys will know. And ADRC stands for Aging Disability Resource Center, correct?
Correct.
Okay.
And Sheila, I just put in the chat box the Kentucky state level unit for aging and independent living, their email and telephone number.
Awesome. Okay. Any other questions for our guest today? Okay. Well, I will send the link out to everyone, the recording, when we get it downloaded, as well as these resources. Be looking for those. And